Everyone, and welcome to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example, it's a 3-year-old female spayed domestic short-hair cat who's having dyspnea, lethargy, and inappetance. Now, I'll highlight some of the most important findings for heart and lung in this case. Looking at the lateral view to start, you may appreciate that the heart appears tall, occupying more than 50% of the height of the thorax on this view. It also is evident that the margins of the heart are difficult to see. That could make it hard for you to confirm that it's tall. This relates to the lung pathology that's present, which we'll come back to in a minute. When I look on the ventrodorsal view, I can see that the heart also looks like it's wide, especially cranially, where I'm pointing here. This gives a Valentine type appearance, which is one of the classic findings of cardiomegaly in cats. Now, let's talk about the lungs. When we look at lungs, we first start by determining whether they have an increased or a decreased opacity. Many of you will note that overall the lungs have an increased opacity, but especially here in the caudodorsal lung fields. Once I think there's increased opacity, then I try to look more carefully, especially what I'm looking for is whether or not I can see pulmonary blood vessels. When I don't see pulmonary blood vessels, like in this case, I determine that it's an alveolar pattern. Let's go to the lateral view and compare an area where we do and an area where we don't see the pulmonary blood vessels. For example, this part of the lung here has increased opacity, and when I look carefully, I don't see specific vascular margins. Compare that to the cranial lung field, where if I trace, I can see pulmonary blood vessels going towards the periphery of the lung. I would still consider this lung field abnormal because the vessels are less distinct than they should be. So overall, I would conclude that this cat has an enlarged heart, and an alveolar to interstitial lung pattern. There are a few other minor findings mentioned in the report, such as some thin pleural fissure lines and minor extension of the liver beyond the costal arch. Taken together, all of these findings are highly consistent with congestive heart failure. Congestive heart failure in cats can have a highly variable radiographic appearance when we talk about how pulmonary edema will appear. It can vary from patchy to diffuse and may even manifest as a bronchial pattern. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media. We encourage case discussion, and we're more than happy to help.